A healthy outside starts from the inside. Welcome to Well-Bloom Health Insight. I'm Clara. As usual, here present tips and advice to help people through pandemic of COVID-19. First, practice coronavirus precautions. Second, keep calm and reduce anxiety. Third, interact with friends and family often. The last one, stay positive. So after the little tips, it's time to feel relief and plan to have a good sleep. But what else keeps you up at night? Stress about unfinished work or upcoming test? Or worry about the outbreak of coronavirus? For many people, this stress is temporary as its cause is quickly resolved. But what if the very thing keeping you awake was stress about losing sleep? This unsolvable loop causes insomnia, the world's most common sleep disorder. Your biological clock is responsible for regulating the daily processes your body undergoes, many of which relate to hormone control and sleep timing. This ebb and flow of alertness and body temperature is what keeps you feeling awake during most of the day and fast asleep at night. But when your rhythm goes off beat, your entire body is affected. This can manifest not just as irregular sleep phase disorder, but also as daytime tiredness, difficulty paying attention, poor memory, or headache, like these symptoms. According to the statistics, only 55% of adults worldwide are satisfied with their sleep, and more than 80% of people want to improve their sleep quality. 67% of people are used to wake up at least once during the night. So, what causes insomnia? Almost anything can cause the occasional restless night. The noise, physical pain, emotional distress, or jet lag can easily throw off your biological clock. However, some long-term conditions like respiratory disorder, gastrointestinal problems, mental health disorder, or the side effects of medication can overpower fatigue. In most cases, the sleep deprivation is short-term. Practicing a good sleep hygiene and maintaining a consistent sleep schedule will gradually reset the biological clock. But sometimes it becomes long-term sleep disorder, which we call insomnia, or more dangerous occasion, comorbidity, which refers to the co-occurrence of two or more disorders in a single patient at one time. For example, like insomnia, anxiety, and depression. In depression and anxiety patients, it easily begins a cycle of sleeplessness that becomes insomnia. And insomnia itself predisposes many other health conditions, which in turn worsen insomnia symptoms. So it becomes a vicious cycle. But is there any way to break this kind of cycle? Some people prefer to use traditional ways, like reading, decrease the caffeine consumption, or even decide to take some hypnotic drugs. But the side effects of drug abuse will lead to lack of concentration, drug addiction, or depression. For the people who don't want to take hypnotic drugs, what should we do? We could provide a solution by a gentle supplement. Let's simply clarify the pathology reasons of insomnia. One is the lack of melatonin, and one is the nervous system overly vigorous. Melatonin is a hormone in your pineal gland. Evening peaks and morning drops in melatonin play a role in regulating sleep-wake cycles. And we're gonna discuss the relationship between tryptophan, serotonin, and melatonin. In addition, an overactive sympathetic nervous system will lead to insomnia by creating hyperarousal in the mind and body. So we're going to talk about GABA and glycine. Let's start from the tryptophan. Tryptophan is an essential amino acid which is used to produce the monoamine neurotransmitter serotonin and hormone melatonin. Serotonin is important in regulation of mood, appetite, and sleep in the central nervous system, whereas melatonin is important in regulating circadian rhythms. And GABA is an amino acid produced naturally in the brain, and its big role in the body is to reduce the activity of neurons in the brain and central nervous system. Many medications interact with GABA and GABA receptors in the brain, altering their function to achieve certain effects, like relax, pain relief, and improving sleep. As another neurotransmitter, glycine in the central nervous system play a role for binding the specific receptor on postsynaptic neurons. The combination of this specific receptor and glycine activities the chloride channel, causing an inhibitory postsynaptic potential, which is IPSP, which helps lower body temperature and relieve anxiety to further improve sleep quality. So here becomes the golden cycle formulation. We use tryptophan, GABA, and glycine to improve the sleep quality and shorten the sleep latency, and also put calcium and magnesium, which is benefit for the nerve conduction. And Welbloom could produce any kind of dosage forms here for this formulation. But personally, I will recommend to make with sublingual paste, which could be absorbed onto the tongue, carried by veins into the heart, and pumped into the systemic circulation. Especially recommended for the products which is seeking quick result. So hope you guys enjoyed today's video. Please don't forget to subscribe if you haven't. And if you need any detailed information, please contact us by using the QR code here or click the button. See you next time. Bye bye.